Hi guys, it's Kenzie here from Wasatch Physical Therapy. I am here with Tyler Landgren and Mitch Lillywhite, who are both PTs here at Wasatch. So I'm going to let them kind of introduce themselves a little bit and tell you some of their specialties.
So I'm Tyler. We're coming to you from our new Roy Clinic. We just moved in here a month ago. My specialties are, we all do a kind of orthopedic injuries. I specialize in concussions and dry needling as well.
Okay, so I'm Mitch, and I specialize in lymphedema and cardiac rehab, as well as a lot of your common sports injuries.
So we had a few questions come up, so I'm just going to ask them a few of the questions that you guys had, and they're hopefully going to answer them.
Ready? If you have other questions as we're going along too, just comment, or if you're watching it later, comment, and we'll get back to you with, private message or just in the comments.
Okay, so one of the first questions we had was ways to prevent general sports injuries.
Okay, so there's quite a few ways you can help prevent injuries. One of the biggest is just doing a proper warm-up. There was a study recently done where they studied people who did static stretching versus doing kind of a dynamic warm-up. And they actually found that those who did, static stretching, reach down, touch your toes for 30 seconds, those people actually did worse and had more injuries than those that did kind of a dynamic warm-up. So what does that mean? A dynamic warm-up is like doing whatever activity you are going to do, but in like less intense. So if you're going to go on a run, you're doing just a light jog for 5 minutes, or you can do some movements, kind of like stretching. If you're trying to stretch your calves, you're doing a movement through that stretch. So not doing just the whole bend down, touch your toes, and hold it. Okay, so that's one way. Another thing is doing proper strength training. So say you're a runner. A lot of runners, what they do every day is they go out and they run. But if you're doing cross training, so get in the gym, doing strength training, weightlifting, those kind of cross training activities will help to prevent injuries as well. If you are doing heavy strength training, make sure you're giving your muscles a day of rest in between. So you can still say run in between those days, but if you're doing heavy strength training, make sure you're taking a rest every other day. Another thing that causes a lot of injuries is fatigue. So making sure you're getting your proper 8 hours of sleep during the night. Don't try and be exercising and working out if you are already fatigued and tired. That can lead to more injuries. Another great way is to come and see a physical therapist and have a functional evaluation done. So the therapist can see where you are showing weaknesses, where you're maybe more prone to injuries, and can create a plan so that you don't have an injury from those things. So anything you want to add?
No, I mean, the big thing is like with those warm-ups, like those dynamic warm-ups, you want to get that muscle nice and warm before you just, start your activity, because that'll let that muscle contract and relax better, and so you won't have those, those pulls and sprains and things like that.
All right, so the next question we have is, how do I know if I'm injured and when should I seek medical treatment?
Well, hopefully you know when you're injured, you fall and break your wrist or something. But I think more so that question is like, how do you know if you need to just rest and wait, or come in to see like us as PTs, or go and see a doctor, get x-rays or whatever. Usually it kind of depends on what exactly happened, but the big one, make sure you don't wait. If you can't, like say you think you might have just rolled your ankle, if you can't put any weight on that ankle, you can't walk on it at all, or you've got really, really bad swelling, really bad bruising, things like that, those are the times that you definitely need to get in to see somebody. If you can kind of walk it off a little bit and it just aches, it swells a little bit, those are sometimes those injuries are like, I can wait a couple of days, see if it's feeling better. If it's not feeling better within a couple of days, that's when you want to come in and see somebody.
Yeah, and I think that's a good point because swelling, if you have an injury, you roll your ankle, it's going to swell up, and that's kind of a normal body response. But if that swelling is lasting more than 2, 3, 4 days, that's, the severity of the injury is going up. So swelling's a big indicator. I think another one, if you're having any numbness or tingling in whatever area, you injured, that's a sign of nervous system injury. And that's obviously makes that scale go up. That's a little more serious if you're having numbness and tingling. Like Taylor says, if there's any open wounds or excessive bruising, things like that, it's time to get in. And if you're unsure, you can always, here at Wasatch, we do free consultations. So you can always come in, spend 15 minutes. We can just do a quick look at it and kind of give you that idea. Okay, this is more serious, or nah, just put some ice on and you'll be okay.
Okay, so the next question, Mitch talked a little bit about kind of the procedure about what seeing a PT for sports injury is. So can you elaborate on that a little bit, kind of what they should expect? Yeah,
so that's a good question. So, okay, what if I do want to go see a physical therapist, what is the procedure? Do I have to go to the doctor first? Can I just go right to the therapist? It's a little bit of a tricky question. It kind of depends on your health insurance. Some insurances require that you go and see a doctor first before you see the therapist. But if you're unsure, our receptionists are great. They can, if you call and give them some of your health information, they can look it up for you and see if you've got to go to the doctor, or you might be able to come straight in to see the therapist. We also offer, like I said, the free consultation. So if you're unsure, just give us a call. We can take a quick look at it, and then we can go from there. Maybe therapy is appropriate, maybe it's not. Maybe there's another specialist or something you need to go see. The other option is we do have like cash pay options. So maybe you don't even want to go through your insurance. You just want to do a couple therapy visits and maybe just learn what to do, and you can do it on your own. That's totally an option as well.
Yeah, so how the visit will typically go, you'll come in, you'll sit down with, one of the therapists, me, Mitch, or one of our other therapists we have working with us. We'll ask you a bunch of questions. We'll see how the injury happened, what your symptoms are, those kind of things. And then we'll go through a whole exam. We'll, whatever, if it's your knee, your ankle, your hip, whatever, we'll kind of see what is bothering it, what's irritating it, what makes it feel better. And then we can see what structures are involved, and then we make a whole plan based on those findings on what you need. Whether it's flexibility, range of motion, strength training, or if it's just managing swelling and those kind of things. We kind of, it's an individualized approach for each person. Those first visits, if you're doing a whole therapy visit, you got to plan on at least an hour or so to go through all of that fun stuff.
Yeah, I think that's a good point, because every injury is a little bit different. Every person's a little bit different. So we really strive to make an individualized program for each person and each injury, and make it tailored to you. So it's not just a cut and dry, everyone with an ankle sprain gets the same treatment. We really try and individualize it for each person. So.
Okay, so kind of going along with sports injuries, Tyler, can you talk to us a little bit about concussions?
Mm-hmm. Yes, we kind of thought about talking about sports injuries because, well, there's no sports going on right now, and I miss watching sports. So with a concussion, so what a concussion is, it's actually a brain injury. So with a concussion, you'll see them in every sport, football, basketball, soccer, hockey, but actually a lot of the concussions that I see here in the clinic are actually coming a lot from car accidents and falls and things like that. So anything where you hit your head can cause a concussion. So with a concussion, the signs that we're looking at with a concussion, you say you're in a car accident, you hit your head on the steering wheel or the airbag goes off or whatever. If you're going to have, headaches, dizziness, nausea, possibly light or sound sensitivity, these different noises will kind of cause headaches or any of those kind of weird symptoms. And so that's usually what you'll see with symptom-wise. Some things to be concerned about with concussion. Usually, when you have a concussion, most of those resolve within a couple of weeks. About 85% of concussions resolve within the first 2 to 3 weeks. But it's the ones that aren't getting better on their own that need to come in and see, a therapist. Let's go back to that kind of car accident. Say you lose consciousness, you're vomiting, you're having numbness or tingling, those kind of things. Those are the signs when you need to go in and see, those are like emergency department. You go see somebody immediately to make sure there's not something else going on. Because with these head injuries, it could be a skull fracture. It could be, a neck injury or something like that, which can cause a lot of issues, a lot of worse issues. And so those are the things to look at with some of those.
And I think going along with that, those concussions, if they aren't treated early in those first couple weeks, it exponentially gets worse as time goes on. And so it's better to get in and get it treated if you're wondering, is this that big of a deal or not? It can be, especially the longer it goes on, those symptoms can get worse and worse and worse, and they're harder to treat the longer that goes on. So.
Okay, so what can a physical therapist do for concussions?
So there's a lot of things. So with the dizziness, there's a lot of stuff that therapists can do for the dizziness, for the headaches, and the activity tolerance they can do. Because a lot of times after a concussion, as soon as you start exercising or even just walking around the block, those symptoms start to come back. And so in therapy, we do this graded exercise progression, where we start just slowly introducing new activities, new things to help you deal with that. Like I said, it's a brain injury. And so those pathways that are going from your different systems, whether it's your balance systems or things like that, kind of get thrown out of whack a little bit. And so with therapy, we can kind of help reset some of those with different exercise, with different treatments. A lot of it comes with, balance training. We start doing that graded exercise progression. We start, light, we're just going to bike for 5 minutes on a stationary bike. And if that's all you can do, that's where we start. I've seen patients that have been that bad where 5 minutes barely pedaling on a stationary bike, their headache goes from a 2 to a 7 or 8. So that's when you have to stop. And the big thing that I tell a lot of my patients with concussions is that you don't want to force yourself through the symptoms. You can't just fight through it. It's when you have symptoms, that's your body telling you to take it easy.
Okay, can dry needling be used as treatment for a concussion?
Yeah, so like I said, I injured myself. I did some dry needling. What I found with that, it helps with the neck part of the concussion. So let's go back to that car accident. You get that kind of whiplash, your head goes, your neck hurts, you're getting headaches. What the dry needling can do for that is it can help reduce a lot of that pain that's coming from those neck muscles that were stretched and pulled and strained. That then we can kind of take some of those out of the equation with the dry needling, and then we can focus a little bit more on the, some the balance things, the visual things, and those.
So how will an athlete know when they can return to sports after a concussion?
So the way I do it here is I have I talk about that graded exercise. So there's all these different stages, and stage 1 is everything's pretty static. You're not doing a lot of movements. You're kind of just light exercise, walking on a treadmill, going light on a bike. And then as you do that without symptoms, then you go on to the next stage. And that's when we'll start doing more some balance exercise, some different things like that. And each stage you have to be symptom free. You keep going on to the next one. There's 5 stages, and the 5th stage is actually just going back to normal practice. So we say you're a football player, and stage 5 is you go through practice, and if you can go through practice and you can be symptom free, then that's when we'll kind of go on the back to sports. But it is symptom free.
And I think that's a big worry for a lot of athletes is well, I've got this, and a lot of times concussions go unreported because they're worried about being pulled out of their sport and they're not going to be able to play for this long period of time. A lot of the concussions we said they're resolved within a week and mostly 2 weeks. So if you have, you're playing football on a Saturday, you have a concussion, if you can go through all those steps, then they're usually a day each. And so you said there's about 7 steps. You're really only going to miss 1 game if things go well. And so you won't play that next game. By the time the next week comes, most players are ready to play again if you run through the protocol correctly. And that's important. If you are doing it correctly and you don't push yourself too hard, the recovery can be quicker.
Yeah. So.
Okay, the last question I have is, can someone come in before sports for cognitive function?
Yeah, so this cognitive function testing, or baseline testing, however you want to call it. So it's another tool in our toolbox kind of thing. So it's a computer-based test, and kids can do it from age, I believe, 6 and up. There's different tests based on how old you are. But it's a test that I like to do for our kind of youth athletes. A lot of high schools do this. It's kind of mandatory for some sports, but you come in and do this test on a computer, and it tests memory, it tests reaction time, and different things like that. And it's a good test to have this baseline measure. So if later on you have this suspected concussion, and because sometimes I don't have a lot of symptoms, I have a headache, but I don't, I feel okay. It's another test that we can redo, and we can see how well some of those mental functions are doing, how quick you're able to react to shapes and sounds and things like that. So it's not the end all be all, but when it comes to concussions, it's always better to have more information than less. We offer this, we use a test called the impact test. It's probably one of the more widely used ones. We offer it for, anybody can get it. If you just, hey, I want to take the test in case I ever get a concussion, you can always come in and do it. But we try and offer it for a lot of our youth sports. Our little league football and soccer leagues, and have the kids either come in, or I can even just send you a code and you can do the test at home, and then I have the results. But to do it before the season starts, so if there is that injury later on, we just have one other thing that we can look at to make sure that it's getting back to normal.
And I think to note, the test lasts for 2 years. So you don't have to do it every single time you go to play a sport. If you have that baseline test, it'll last for 2 years, and then you can always refer back to that. If you think you have a concussion, you redo the test, and then you can compare the results. So.
Yeah. Any other question we had, Kenzie?
Nope, that was all the questions that we had.
Okay, well, thanks everybody for watching. If you do have more questions or you want more information, please comment or message us on Facebook. We'll try and respond as quick as we can. Yeah. Thanks.
Okay, thank you everyone.